Okay. Hello.
Hi.
My name is Jalen. I'm with Valdosta State. I'm one of the nurse practitioners with their mental health program, and I'm here to do a mental health assessment. Is that okay?
Yes, that's fine.
All right.
My name is Shannon.
Okay. I've done my hand hygiene. Okay. So, just tell me what are the events that led you in today, and who brought you in?
My best friend brought me in because I've been moody, depressed, out of sorts, brain fog. Um, it's severe insomnia, and now I'm crying intermittently. Sometimes I know why, and sometimes I don't.
Okay. And how long has that been going on?
Off and on for the last 6 months, but more prevalent in the last 30 days because I had to have some oral surgery, and that just took me out.
And the surgery was when?
2 weeks ago Monday, and then I had complications from the surgery.
Okay. And you said you sleep, so about what time do you go to sleep?
I work nights, so on average 8, 9 in the morning.
Okay.
I try to go to sleep, but I'm not sleeping.
So about how many hours would you say of sleep?
Maybe 2 good hours of sleep a day.
Okay. And what about your appetite?
It's gone. Or it's to one extreme. It's either I want to eat up everything or I don't want to eat nothing.
Oh my goodness, I'm so sorry. That must be really, really hard.
It's very traumatic.
Yeah, I'm sorry to hear that. I want to talk about some just simple questions, okay? Normally when people are experiencing this, they're having some coping skills of using some type of substance abuse. Have you been using anything substance-wise to?
I drink more red wine than normal.
Okay, and how many bottles of wine or cups of wine?
A bottle every 2 days.
Bottle every 2 days. Okay. And what about your eating? Have you had a loss of appetite?
Either I have a loss of appetite or I use the food as a coping mechanism. So some days I eat up everything that I like, and other days I eat not at all.
Okay. So the eating is okay. And does anyone at home, or you living by yourself?
I live alone.
You live at home. And who would you say is like your support system?
I have neighbors and friends.
Neighbors and friends. Okay. What about some coping skills or like hobbies that you've done in the past that kind of helps with
It
this?
doesn't help. I tend to isolate the things that I would like to do. I don't do anymore because I prefer to be isolated. So all I do is work and get in the bed and watch TV.
Okay. And what is your current mood right now, would you say?
I'm just functioning, meaning I'm laid back. My self-expression is, I don't express. I just stay in one mode or one mood trying to get through the day. Okay. So there's no happiness. There's just dreary. I keep all the lights off. I don't get dressed unless I have to go to work, and I don't leave the house.
Oh, I'm so sorry. My goodness. Okay. Are you having any anxiety with this?
I can't. With the anxiety so bad, I don't want to be around people. So where I used to go to the grocery store and take care of my errands, I don't do that anymore. If I can DoorDash it, if I can have it delivered, or if I can have somebody bring it to me, that's the preference. I don't go around people unless I have to go to work.
Okay. Are you seeing or hearing things that are not there? Mm-hmm. Are you smelling or feeling anything that is not there?
No, I tend to talk to myself out loud. That's a coping mechanism.
Okay. And sometimes I'm not saying that you would do this, but I still have to ask, are you having any thoughts of ending your life or harming yourself?
I don't have the thoughts of suicide. I just prefer the isolation of the suicide, meaning I don't want to be around people. So I'm sorry.
Okay, it's okay. And do you have any plans or any methods?
No. As long as I have my wine, I'm okay.
Okay. Well, give me 3 good reasons for you to not end your life or harm yourself.
I have a son.
Okay.
The thought of my family and friends crying over me.
Okay.
And I just have other responsibilities that people depend on me to do.
Okay. Those are good 3 reasons. Okay, I want to go into just some cognitive questions. Do you know where you are right now?
Yes,
Okay, can you tell me?
I'm in Atlanta at Piedmont.
Okay. Do you know what day it is?
December the 4th.
Okay. And it's okay. And do you know, do you remember who I am?
Jayla.
Okay. Awesome, awesome, awesome. And some other things that I would like to ask you about your thoughts. Have you ever thought about harming others?
No.
Okay.
If I'm angry, it's more internal, not external.
Okay. Okay. And I would also like to ask, do you sometimes feel like you have certain thoughts or certain behaviors that repeat themselves?
I'll do certain behaviors that repeat myself, meaning because of the brain fogginess and the depression, I forget where I put things, so I have to backtrack. Or I can't remember sometime where I'm going or what I'm doing, so I have to backtrack. I have no desire to, some days if I don't have to leave the house, then there's no hygiene. I just look unkept, and I'm okay with that.
Okay.
I'm okay with that.
So,
especially since I had my teeth pulled, I just don't feel the same. Actually, I feel worse.
Sorry. Yeah, I know that was tough. So would you say these are impacting your daily life and taking care of yourself?
Because I don't eat the same because my teeth is gone. I don't desire to eat the foods that I used to like because my teeth is gone. And I don't desire to look in the mirror because my teeth is gone.
Yeah, I know that's very difficult. Very difficult. Okay.
Especially since I spent so much time and money on them.
I can only imagine. And that's why we're here to help. So that leads me to my next question. What are some things that you think would benefit you?
Besides therapy, and I need balance. I need whether it be therapy or medications to help balance out the mood, and then possibly I would like to consider hormone replacement because I'm at that age where I'm perimenopausal too, on top of the depression and everything else.
Okay. And just a question that I like to ask for patients that's going through this, just so I know that you have the right judgment. If you was to be at home, you say you live at home by yourself, and you smell smoke, what would be your first thing to do? You smell like fire.
I would try to figure out where it's coming from first, and of course, notify the authorities.
Okay.
And get out.
Okay. Awesome. That's a good. Okay. Is there anything else you would like to add on to this session?
Maybe bring in my friends the next time I do a session. Maybe that might be somebody from the outside looking at me different, just to give you another perspective on things that's going on, because sometimes you don't always see what's going on with you. Sometimes it takes another person to see what's going on too.
Okay, all right. Well, thank you for talking to me.
I appreciate it,
Miss Shannon. It was a pleasure. And I will go talk to my team and the rest of our people and see what plan we come up with.
Please help me, please.
Okay.
Please.
Thank you so much.
Thank you.
Mm-hmm.
Bye-bye.